Hey, welcome to Shop Talk with Cassandra Renee. With me is my co-host, Kevin Eaton.
Good morning, everyone. Good morning. Good
Hey,
morning. Glad to be here. Another Monday. This week went by so fast, huh?
it sure did. It sure did. I think I need the volume up on mine too.
Yeah, it
Yes,
went
it
so
did.
fast. It looked like just yesterday we were just in the same booth here a minute ago,
I
huh?
know time is flying. Is it because we're getting old fast or what is it?
Yeah.
Oh, I don't want to hear that. You weren't supposed to answer it that way. You
That's
know,
exactly what it is.
we are very excited to have two representatives here with us from the Baltimore City Cancer Program.
Yes, and we have just lucky to have them here. We like to have our guests in the audience and in the studio today. Yep.
But before we go into introductions for them, we are going to, Kevin is going to start his Show Your Right segment.
Show you right. Show
Show
you
you
right. Yeah, we
right.
talked last week about our show you right moment about our parent-teacher relations. We hope that you guys heard that, and we'll get a part of being with your parent-teacher relations. This week we're going to concentrate on your right brain activities. Okay, if you're not familiar with the right brain and left brain, our brain is separated into the right brain and the left brain. Our right brain activities pretty much has to do with your artistic side, painting, sculpting, dancing, singing. And our school system have gone to what's called STEM program, which is science, technology, engineering, and mathematics. And a lot of the students are going to these STEM programs. They start in elementary school, middle school, and they've already determined they're going to be doctors, engineers, and people in that field. But we don't have anything in schools that has to do with music and art and dance and stuff. So one thing I want to bring out, how people are talking about dancing in church. People don't like about dancing in church, like stuff like that. But one thing about our church is that we have been like a society filler. When something has not been working for us in society, we found a way to get into the church, and the church has sort of filled that gap. So people talking about dancing in church, stuff like that. I mean, it may be right now the only way that our population, our kids get an actual opportunity to use that right brain activity. So I would just like to express to the parents, when you go out buy games like your PSP, try to get a right brain game also. Like some crayons and maybe light bright, and we had etch a sketch and stuff like that.
Oh, yeah, Etch a Sketch.
Yeah, and so this the right and left brain actually came about in the 60s by psychobiologist Roger W. Sperry. And he the one that actually broke down how your brain has two sides, the right side and left side, and how each side is different when it comes down to your actions and how it analyzes things. So just to conclusion to this is that basically what I would like to for the show you right moment
Show You
is
Right.
let's concentrate on activating our left brain. We're doing good with the right brain,
Right,
because
right.
we're good with the left side, but that's got to do with going to school, learning your math, learning your science and stuff like that, which is excellent. But we don't want to leave out our right side of the brain when it comes down to our music, our dance, our singing, poetry and stuff like that, which actually gives us culture.
Yes.
Okay,
Yes.
so that's our show you right moment.
Show You Right.
Let's be a little bit more right-brained.
Yes, more
Yeah,
right
yeah.
brain did.
Okay.
Thank you so much, Kevin.
All right.
So now we're going to move into our very special guest that we have here today. We're very excited, and we're already getting great feedback. I mean, our listeners are very excited to have the two of you here. So would you please introduce yourselves?
I'm Rhonda Silver, and I am a division administrator from the Baltimore City Cancer Program. We are from the University of Maryland Greenbaum Cancer Center, and we are a program that's been in existence for 11 years. And we're here because we want to show an improvement in Baltimore City. We want to go after women and men who live in Baltimore City from the ages of 40 to 64 who have no insurance or underinsured. My program, which is sponsored through the cigarette restitution through the state of Maryland, and also the colorectal program through the Center of Disease Control, and we want to give out free exams. If anyone fits this category, who lives in Baltimore City, who is underinsured or no insurance at all, we want you to call our program at 410-328-HOPE.
Wonderful. And also, too, if we are opening up the phone line, so if you have any questions, please call 410-481-1010. That's 410-481-1010. Okay, and we have another guest here with us.
I'm Linda Hollander, case manager over at the Baltimore City Cancer Program, and I evaluate the results of tests and help them get the other care that they might need.
Wow, that's excellent.
Welcome to the studio, Linda.
Welcome. You know, this is part one of a two-part segment. It's going to be today, and then we're going to skip next week, which is Labor Day, and then they're going to be back with us. What is that, on the 9th? The following
ninth,
Monday,
yes.
and we're going to start part two. But as far as part one, we're going to be mainly concentrating on colon cancer screening. Is that correct?
Absolutely.
Okay, and my first question to you, and it's a very basic question, but there may be some people who don't quite know what a colon is. What is a colon? What is its function?
The colon is part of the digestive system. So when one eats, when you eat and you begin to chew from your mouth, that begins your digestive process, and that normally takes several hours to work its way down through your mouth, down through your esophagus, and then landing in your stomach, and it stays there for a couple of hours because then you have all types of acids and things that are combined into that food to help churn it up and churn it on out. So foods that are nutritional in value will go, of course, through your bloodstream and all of that, and then there is the waste piece of it, and that begins, once it begins leaving your stomach, it travels through your small intestines, and then it travels all the way through to your large intestine, and then all of your bowel and waste will come out of through your rectal area
Wow,
after several hours.
several hours. Okay, what are the symptoms of colon cancer? So my understanding is there may be two types of symptoms. So what are the symptoms?
There are many symptoms
Okay.
that you really need to be aware of, and sometimes they mask themselves under other categories where you may see blood in your stool, and sometimes that blood in your stool could be from internal hemorrhoids or external hemorrhoids. So sometimes when that occurs, we don't want listeners, or we don't want people out there who are having these blood in their stools just to ignore it. Please don't do that. There's always some reason why that is happening. It's abnormal for it to happen, but there's a reason why it's happening. And so you can have the blood in your stool, frequent changes in your bowel movements. You may have seen a change over 6 months. Severe constipation, a lot of diarrhea, things that are different in your system that you're not used to. So if you're normally having these bowel movements once a day, twice a day, and then all of a sudden it's not happening at all, or it's happening too frequently, or there's some blood that's involved, then that's something that needs to be looked at.
I have a question. You mentioned blood in your stool. How would one know that it's actually there? And I asked this question because my mother had surgery recently last year, and she had the surgery because they found blood in her stool, but it was nothing that she could actually look in and see.
Some people, and I can tell you that because of what we've seen, are seeing it in the stool.
You'll actually see the blood.
You're actually seeing it.
Okay.
Some you can't see, and so there's also a kit they call the FOBT kit, and this is a kit that sometimes a lot of physicians may use, and it's usually a little kit that you take home and you get a stool sample, you put it on the little card, and then you send it back in. You send it in to be tested. A lot of times at that point in time, once it's diagnosed, you can see that their stool, because you can't see it with the naked eye. So
Right.
there are instruments, there are tests that can be done, and the FOBT kit is one of those.
Can it be purchased from like Rite Aid?
Normally that's given to you by your physician because someone has to explain it to you. You don't want to get this kit and not do it right. So you have to be instructed on how to do it, how to use it, how to close it up, and how to ship it back. So
Okay.
you really are not going to go to a Rite Aid. You're really going to be talking to a physician.
Okay.
We have Miss B on the line with us, I believe. Miss B?
Good
Good
morning, Miss
morning,
B.
Renee.
How are you? That's
Miss
good.
B is a regular contributor to our program. She's actually a trichology correspondent for the show. So welcome, Miss B. How long of a period after seeing symptoms should a person go to see their doctors? Should it be immediately? Okay.
Immediately.
Okay.
We always recommend that you do, because you don't know what's going on, and because these are things that you are complaining about that are different, we encourage you to seek medical advice.
Okay. What happens during the initial examination?
The initial exam, the physician normally does a history. They want to hear about your past and present history. It's always important to find out from that patient what is your past history? What is your family history? Before they kind of get into what is your present history. So it's always good to find out what's going on in your family, what's going on with you individually. So normally that first exam is a lot of fact finding, a lot of asking a lot of questions before you get an exam. Yes, you will usually get the exam on that, not a colonoscopy, but you may have a physician who may at that point in time check you and also talk to you about the FOBT and possibly do some blood work or possibly then set you up for a colonoscopy to be
Okay.
seen by a gastroenterologist.
So is that considered the screening?
That's
then,
usually
that
the
initial?
pre-exam. We always send, and I can tell you now, what we do, we send out patients for a pre-exam.
Okay.
That's the fact-finding period. That's when you are talking to the physician about your family history, your present history, any complications, any issues or problems that you may be having with any bowel movements or any things that you've seen, any blood. All of that's talked there.
Okay.
And then at our practice, we normally do some blood work. And if that blood work is normal, then we'll proceed on with the colonoscopy. So the patient is seen first for a pre-exam by the gastroenterologist. All those questions are asked. We also set you up for the blood work, then we set you up for the prep kit. And then you're given instructions on that day of how to use the prep kit. Then you make the appointment on that day of when you're going to come back and have the colonoscopy along with bringing someone with you.
Right.
You cannot have that exam unless someone's with you because again, there are times that you're sedated.
Right, right. And I noticed you mentioned something about family history, fact
That's
finding.
very important.
So is it hereditary?
Yeah, there are factors in one's history that family members could have had a colonoscopy and had several polyps. And that in itself is something that it's important because that normally determines when, after you've had your colonoscopy, and if a polyp is found, will kind of determine when you're going to come back. It will, normally you come back in 10 years, but there are times where if there's numerous polyps or polyps in and they usually go by your first degree relative. So it's your mom, your dad, your sister, your brother. And if they're having issues or problems, then we're going to take a closer look at the individual who's coming in for that particular colonoscopy. And that may determine whether or not that patient may come back in 3 years, in 1 year, in 5 years, something like that.
Okay, but it's usually what, every 10 years?
It's usually 10 if there's no polyps that are found.
Okay.
Or if it's a hypoplastic polyp that's found, you can go 10. Polyps are slow growing, and that's why we encourage our ladies and men to get their colonoscopy exam at 50. Early detection saves lives.
Yes.